Welcome back. Industries across the country facing labor shortages. One sector really seeing the big shortages are healthcare. One startup is helping fill the gap in staffing by taking a page out of Airbnb's playbook. Joining me right now is the co-founder and CEO of Nomad Health, Alexi Nazem. Alexi, good to see you.
Thank you, Maria. Great to be back.
I love the way you talk about how this whole process works, because we know that that's where the jobs are, healthcare. And there's this incredible need for nurses and medical staff. Tell us how Nomad works and how you're actually putting it's almost like freelancing in terms of nursing, right?
Yeah, that's exactly right. I mean, healthcare is now the largest source of jobs in the United States. That market is very tight. So hiring efficiently is incredibly important. That's exactly what Nomad does. It is by far the most efficient, most cost-effective way of hiring doctors and nurses for freelance work.
How do they get paid?
So basically the way it works is that a hospital or a clinic will come to us, say we've got this need for a short term. They'll post those positions onto Nomad, and then we've got a large network of tens of thousands of clinicians who we match to those jobs, and then we organize all of that intermediate work, the background checking, etc. The hospital pays us, we pay nurse.
That sounds really fascinating, and it's a big opportunity for people because of this massive shortage that we're seeing. What's your take on why the shortage is happening? Is it because we're living longer? What?
Yeah, it's multifactorial. Probably the biggest thing is demography. I mean, the graying of America is a real thing. The baby boom generation is aging into this 65-plus bracket. Every day, 10,000 Americans turn 65.
Right, and
people
we're living
over
longer.
the age of 65. Yeah, over the age of 65, you require 3 times as much health care, and so just the demand for health care services is exploding, and that's why we just need so many more doctors and nurses.
That is
huge
really,
shortages.
It's terrific, because I know every week, every month when we do the jobs numbers, we focus really so much on where the jobs are. We're identifying them, and I know healthcare has been up there for now a lot of years.
Well, and amazingly, last month, for the first time since the BLS has been tracking, healthcare surpassed retail as the largest source of jobs in the economy.
And we saw that comment. So you recently announced an expansion into the New York market. Tell us about Nomad. How big of a deal is it for the company? What cities are next? What are you doing specifically in New York?
Yeah, we're growing really quickly. So we doubled down in New York, launched our nursing market here. We've expanded to a number of other states as well. We're in about a dozen states currently. The size of our market has tripled in the last few months, and we're continuing to grow at that pace every quarter. So we're planning to be nationwide, hopefully by the end of this year.
What are your thoughts on the Amazon effect? I mean, we know that there's a deal, CVS and Aetna. There's a partnership between Amazon, Berkshire Hathaway, and JP Morgan Chase in terms of the insurance side of things. A real disruption happening in terms of healthcare.
It's an extremely exciting time for healthcare right now. I mean, the JPM and Amazon Berkshire thing last week it's just so cool. When it's not so much the what, but the who, that you've got these extraordinary innovators coming from other industries where they have decided, listen, we're not going to wait for everybody else to figure out how stuff works. I just love, for example, that Amazon is saying, we're going to build this just for ourselves, just for our own employees. That's what they did with Amazon Web Services. They built it for their own warehouse.
By the way, they do it for themselves, and then immediately they put competition into the market.
Exactly.
Yeah, and so that's going to shake up prices.
And it's great. I mean, it's a wake-up call for healthcare. I mean, really, we cannot keep doing what we're doing. We can't be different if we stay the same.
How do nurses and professionals in the medical field become part of your network? I mean, you say, when a nurse has to get paid and they're basically putting them into the system in a freelance way, how do you identify those nurses to become part of your network?
I mean, they're coming from all over the place. One of the most important things is just referral. People have good experiences on Nomad.
Word of mouth referral.
Word of mouth. But then, we do a lot of marketing and things like that. We work with schools and residencies, and basically the amazing thing is that doctors and nurses really want to answer the call, see patients, and this is an easy way to get to the bedside. Actually, but Nomad removes so much of the friction to getting hired, and so it allows doctors and nurses to do what they want to do, which is practice medicine. So they come and find us.
Alexi, good stuff. We'll keep following it.
Thank you so much,
Thanks so
Maria.
much. Alexi Nazem there.